Ophthalmic drug lecture. Dry eyes is the first classification we are going to talk about. They increase the tear production. Some of the common medications are Restasis or cyclosporine, Refresh, or artificial tears, which is over the counter. It is important to note that any eye drop medication, whether it be for dry eyes or for glaucoma or an antibiotic, contact lenses should be removed during eye drop application and should be left out for a minimum of 15 minutes. Ocular infections and antihistamines. Infection medications are bacitracin ophthalmic, erythromycin ophthalmic, and Tobarex or tobramycin ophthalmic. Antihistamines are Visine. Corticosteroids are also used in acute eye injuries to prevent scarring. Some examples of our corticosteroids that could be used are dexamethasone, prednisolone, and fludrometazole. It is important to note that patients should not be on corticosteroids for a long period of time, especially during eye injury or eye infection. And it is also important to note that infection medications can cause hypersensitivity. Mydriatics and local anesthetics. Mydriatics are used topically to dilate the pupils for eye exams. Medications are atropine and phenylephrine or midrephin. Atropine works by paralyzing the muscle of accommodation, hence making it easier to examine the eye. Local anesthetics are applied topically to the eye for procedures. The most common medication is tetracaine or Teravis. Glaucoma medications. Glaucoma is due to the increase in intraocular pressure. There are two types of glaucoma. Acute glaucoma, which is usually an emergency and patients should be treated as soon as possible. Chronic glaucoma, also called open-angle glaucoma, is a slow progressive disease. There are 5 main categories of these medications that treat glaucoma. The first one is carbonic anhydrase inhibitors, mydriatics, beta-anhydrase blockers, alpha agonists, and prostaglandin analogs. The most common are beta blockers and prostaglandin analogs. Carbonic anhydrase inhibitors reduce the formation of hydrogen and bicarbonate ions, which have a diuretic effect, and reduce the production of aqueous humor. Medications commonly prescribed are acetazolamide and dorzolamide. Mydriatics may cause the pupil to contract. They also reduce the intraocular pressure by increasing the aqueous humor outflow. They act by contracting the ciliary muscle. The most common medication in this class is pilocarpine HCl. Beta-adrenergic blockers, also called beta blockers. They lower the intraocular pressure by decreasing the rate of aqueous humor production. Common medications are Timidol or beta-Xol. It is important to note that if patients are on a beta blocker for a cardiac condition, they should not be treated with a beta blocker for a glaucoma condition. They should not be on dual therapy with beta blockers. Alpha agonists decrease the formation of fluid and increases the outflow of aqueous humor. Medications are Elfgan, prostaglandin analogs are first-line agents because they cause the greatest reduction in the intraocular pressure by increasing the outflow of aqueous humor. Most common medications are latanoprost and travoprost. It should be noted that patients should be warned that their eye color can often change with this medication.